If you've been taking a PPI medication, which is very common for acid reflux, gastritis, hiatal hernia, then this is an aspect of the risk that you want to know about. All the way back to 2010, the Food and Drug Administration warned that those taking PPIs for a long period of time, which they defined as over a year, or at a high dose, were at risk for increased risk of fracture in the spine, hip, and wrist. Now, it's the wrist because if somebody falls, they tend to, throw their hand out and to try to break their fall, and so then the wrist gets fractured. But what it really has to do with is a weakening of bones. So a lot of times in the elderly population, it's not that you fall and broke a hip, but rather your hip broke and you fell. So regardless, getting back to the mechanism now associated with how PPIs put us at risk of weakened bone and fracture. The first one has to do with decreased calcium absorption. So if you need acid in your stomach to absorb calcium, magnesium, and vitamin B12, we're going to be talking about all three. So getting back to calcium, if you're not absorbing enough calcium, your bone mineral density will suffer over time and you'll have weakened bones. So that's the simplicity there. Now with magnesium, magnesium absorption is important for vitamin D activation, and vitamin D is very protective of your bones. So you need calcium and magnesium both. And so when it comes to vitamin B12 is protective of the sheath around your nerves, and what can happen is that you get muscle weakness because the connection between your brain and your muscles is not happening as effortlessly as it should. Reflexes can weaken or slow. As it progresses, you can get peripheral neuropathy, so you start losing feeling in the periphery, typically the feet. So that can happen from a B12 deficiency once it becomes chronic. The other thing is that vitamin B12 affects bone turnover. So the body is a beautiful, incredible machine, and it's called remodeling of bone. So bone is not a static entity, it is a very live part of our body, and so old bone is replaced by new bone, so that's called bone remodeling, and vitamin B12 helps with that turnover. So again, if you're deficient in B12 because you've reduced your stomach acid, because you're on a PPI, then that's not happening. So it kind of makes sense, the bone is getting more brittle, and it's old bone versus new bone, and so of course it would be more likely to fracture. So we have those three nutrients, calcium, magnesium, and vitamin B12, all known to be associated from a deficiency point of view because you don't have enough stomach acid. In other words, your stomach requires what it normally contains, which is stomach acid, in order to absorb those three nutrients. So who's at risk? Older adults are at risk. Menopausal women are at risk. People who have used PPIs for over a year, as I mentioned earlier, and those who have low dietary calcium for whatever reason, obviously that would be exacerbated. So it is very important to have healthy vitamin D levels, not just for bone health, but for immune health, anti-cancer. It's an extremely important vitamin, actually a hormone. So definitely make sure your D levels are in the robust category. I like kind of 50, 60 plus. As an arena, the line for insufficiency is about, if you're below 25, so I think that's way too low. So get your vitamin D level. It should be part of your annual physical. If not, definitely make sure your doctor includes it so you can see how you're doing with that. And then also weight-bearing exercises. So kind of what that does is it calls upon your body to nourish your bone because you're using your bone, so you're doing weight-bearing. Also is recommended is to get the right amounts of magnesium and calcium, but that's really tough when you're ingesting it but your body's not absorbing it, so a little tougher there. what's the best tip is to have you not need the PPI, meaning there's a reason that you're experiencing that acid reflux. Why are you on the PPI? Because you're suffering from acid reflux and it's miserable, and of course it can create damage to your esophagus. But what we specialize here is getting to the root of that. Why is the stomach being compressed such that it has no choice but to bring the acid up your esophagus? It's not normal for the stomach to be compressed in that fashion. So what is the root cause? And that's not hard to figure out. Many facets to it, unique to each person, but as a summary or as an overall, there's diet, there's lifestyle, there's the health of your microbiome, which is your 40 to 60 trillion plus microbes, bacteria in your colon and their health status, which by the way, PPIs also disrupt that. We look for presence of toxicity, environmental, as well as, in other words, something you're exposed to from the environment, as well as things you've been harboring for a while, like mold or heavy metal, viral loads. So all of these things are looked at, and that might sound complex, but it doesn't have to be, because once we get to know you and learn your health history, certain things will make sense to go after and explore, while others won't, based on your symptoms and your health history. So our programs are completely customized to you, but the more I look into PPIs, the scarier it is, quite frankly, what these side effects are. I mean, over and above what we're talking about today, I mean, nobody wants weak bones and wants to have a fracture, because especially as you're older, that's a bit of a death sentence when you have a hip fracture or a spine fracture. But over and above that, we're talking about stroke incidents and heart attack incidents and stomach cancer incidents, kidney disease incidents. So there's a long list of terrible, life-threatening side effects here in this drug that you should be able to get off of by getting to the root cause of why your stomach is being irritated. So that's what I want for you. I don't want you to suffer from these side effects from a drug that we should be able to get out of your life. I'm not guaranteeing it. I'm talking to you from a general perspective and what we see here at the clinic a huge percentage of the time. But it's certainly worth looking into, because not only are you then escaping these dangerous side effects, but you're regaining your health. You're handling your hiatal hernia, you're optimizing your gut function, and that's a wonderful thing, and that's what I want for you, the very best health, because life is so much more enjoyable when you feel great, and you deserve that. So if you enjoy the content of this video, please consider subscribing to the channel. We're trying to increase our subscribers so more people can be exposed to this information and gain help. Also give it a thumbs up, share it with a friend or someone you care about who maybe is also taking these medications, and I'll talk to you soon.